All right, and I just want to confirm that people on WebEx can hear us. Or if you can't, let me just
Can
make
hear.
sure here.
Can hear you. Yep.
Perfect. All right. Great. Okay. So my name is Henry Caligari. I am the Senior Coordination Manager for Public Safety and Accountability with Baltimore County. Very happy to see everybody here and on WebEx. I think today is going to be an opportunity for a really interesting conversation on 2 points. But before I get started on that, we'll start with introductions, and I'll turn my right.
Thanks. Good afternoon, everyone. I'm Katie O'Malley from the Women's Law Center.
Good afternoon. I'm Chief Robert McCullough, Baltimore County Police. Good afternoon, everyone. Mark Millspaw, the Director of the Department. Good afternoon. I'm Harrison DeFord. I'm a Senior Data Analyst with BC Staff.
Good afternoon. I'm Roz Berkowitz from the Baltimore County Commission for Women.
Hello.
All right, and now our folks on WebEx, we'll start with Rebecca Allen.
Good afternoon, Rebecca Allen, Victim Service Unit at the Governor's Office of Crime Prevention and Policy on behalf of our Executive Director, Dorothy Lennick.
Then to Shelby Frank.
Good afternoon, Shelby Frank, Executive Director, Family Crisis Center, Baltimore County.
Senator Hedelman.
Hi, Shelley Hedelman, Senator from District 11.
And then finally, UV Radigan.
Good afternoon, everyone. Good afternoon, the Clinical Director.
Great. And thank you again to everybody for attending. We'll jump right in. So one of the recommendations from this working group in its end of the year report in 2024 was the creation of a web page that would pull together a lot of the services that are available in Baltimore County, so that it would be easy for survivors to quickly find those. In working with the Office of Information Technology, we were able to create one, and I wanted to pull that up and show that here. So the SEVDA working group, that's just what I put into Google, but this is the main working group webpage, and we were able to add below the report section resources for for survivors that has, again, highlighted the emergency and non-emergency line. It has a quick exit button, which will take people to the Baltimore County government homepage. That's something which most other jurisdictions have for their sort of their one-stop webpage, because again, that allows somebody who, if they're in a situation where there's where they're sharing space with the abuser, they can quickly move to a less suspicious, for lack of a better word, webpage. And then from here, there are the list of resources. Now, these resources and their descriptions parallel those that are in the one-page physical printout that the Baltimore County Police Department provides and Department of Social Services provide to survivors. So I am happy to make any changes to these based upon what people would like to have here. So victim resources, again, this includes links to the websites, very brief descriptions of what the providers offer. If they have a physical address where people can come to receive resources, those are also provided, as is the phone number. So again, this, and I will include the link, we'll send that out this afternoon so that you all have the opportunity to look at it in more detail. But again, the idea here is that that these resources are readily available to somebody. I also want to highlight that it's not, you don't need to use this lengthy URL to get there, because that was one of my concerns, is that who's going to remember this, and it's not going to be easily accessible. So if you put in baltimorecountymd.gov/SA resources or /DV resources, either one will take you back to this page. I would like to potentially flesh it out and make it its own standalone page on Baltimore County that takes there's not enough information there for it to be kind of fleshed out to get that point yet, but I'm working to get it there. So again, I will send out the link, the main link to our webpage, as well as the shortened URLs. So that can be, again, something that if you choose to, can be shared in your networks. And I'm happy to, again, make any changes. If there's something that you would like to have highlighted in your description for your organization, please let me know. Again, this is sort of it's a published rough draft, for lack of a better word. We wanted to get it online sooner than later, but at the same time, we wanted to, I'm happy to make changes to improve it and to tweak it if anyone has any experience dealing with these kinds of things. Again, the web traffic side of highlighting resources, I'm happy to discuss as well. So again, it's a simple and not a major solution to any sort of these challenges, but it does, I think, help make it a little bit easier given the number of providers who offer, in some cases, very similar, but in other cases, a variety of different services. It can give them an opportunity to find that in one location.
Can I ask a question?
Mhm.
You mentioned that you can click on something so that if you're in a situation that you don't want someone checking on your searches, that you can hide it. How do you do that?
That button that says quick
Quick
exit
exit.
right there, and you click on that, it takes you right to just the main splash page of the county. So again, can be more, I was looking for property tax information.
Right.
So it's not perfect, but I worked with OIT. It's something that a number of other jurisdictions have as well, because and also providers often have it on their websites as well.
Okay.
So, and in addition, it's also, I think it takes you to the main website too. So it's easier for me to put in SA resources than to type out this URL each time I go to the webpage. So
And that hides the history.
it doesn't hide the history. I'm working with OIT to see if there's a way to potentially do that, but I'm not sure if that's something we can do on our end. I think it might be something where the individual, would have to do it. But it's something I would love to be able to do. I don't know if it's an option. All right. So now I want to turn things over to Harrison DeFord from BC Stat. Before I do, something that came up repeatedly during last year's meetings and the first meeting of this year is the need to explore the bigger issues of domestic violence and the sexual abuse, not just as they relate to themselves in a silo or as they relate to the criminal justice process, but also to relate them back to the broader conversations surrounding things like poverty, education, other social determinants, right? To not look at it as an island, but to look at it in connection with broader issues. And we had that conversation with housing. We've had that conversation regarding immigration, but BC Stat has a treasure trove of excellent data that I think is very illuminating in terms of how it relates to issues of domestic violence. And so what Harrison will speak to is sort of the overlaps there. And I'm going to pull up his presentation. I think I probably need to actually hit share here so that everybody online can see it as well. So, oh my gosh, everything pops up all at once. And we're going to start the show. And Harrison, you just let me know if you want me to go to the next slide. Okay.
Cool. So for those of you who don't know, BC Stat recently is part of the Office of Information Technology, but before that we were part of County Administration. And we're basically an internal data wing of the county government. So departments will come to us and they'll say, hey, we have this data. We don't really know how to get answers out of it. Can you help us? And so we kind of, I think it turned to get thrown around a lot of internal consultants where we'll do data analysis, build you a dashboard, whatever. And one of the things that we worked on for the last couple of years is our social determinants of health tool. If you've never seen it, I encourage you to go check it out after the meeting. It's a very cool interactive tool where you can go explore a lot of this information. Henry, you can go to the next slide.
Sure.
So this is what a couple of snapshots of what you'd see inside the tool. We've got, I think, 50 or 60 different indicators that you can go and select from. And the thinking behind it is that non-health related variables often correlate with health outcomes, which kind of gives you a better picture of the processes and the systems that lead to these negative health outcomes. So we created the application 2023, and more or less you can go in and everything's at the census tract level, which is about comparable to a neighborhood. And you can go and you can pick any of these indicators. Some of them are social and community, some of them are specifically health. You can see the next health outcomes. And you can see kind of how they correlate and how they are distributed across the county. So what we're going to do, if you can go back actually.
Oh, sorry.
That's an overview of the application. Basically, this presentation takes some of those data sources that we have in the tool and relates them specifically to DV, which does not exist in the tool. We only collect domestic violence information at the police precinct level, or at least that's the only level that we have access to it. And so what I've done is kind of normalize some of these indicators. Unemployment, we'll see what they are. I think English proficiency, population of the bachelor's degree, a couple of them. And we've normalized them to the police precinct level so that we can directly compare some of these indicators against some of the prevalences of domestic violence, sexual assault cases across the county. All right, so the first one is unemployment. And so the structure of this presentation is going to be, we've got two maps so for every indicator, we've got two slides. The first slide will have two maps, both at the precinct level. On the left, you've got your DV rate. On the right, you've got whatever the variable of interest is. So in this case, it's the unemployment percentage per precinct.
And this is 2023, correct?
Correct.
Yes. So
Yep.
this is the same precinct DV victims per 10,000 that we saw in the meeting last year that the department presented on that went into detail precinct by precinct. And before we go on this, Kevin Edwards, is there anything you want to provide for context on that as a reminder before we start looking at it? It's a broader net than just intimate partner violence. But just wanted that caveat before we dig in.
So on the left, like I said, you see the DV rate, that's victims per 10,000 population within the precinct. On the right, you'll see the percent unemployed in the same geography. So I've taken, they've collected the census tract level, which we'll get a better view of on the next slide, kind of aggregated it or summarized it up to the precinct level, which is a larger geography. On the left, we have what's called a bivariate map, which is a very fancy cartography term. What's important and what will be consistent throughout the slides is you see that kind of pipe-shaped, diamond-shaped legend at the top left. We're interested in whatever the topmost color is, because that, in this case, is where there's high DV victims and there's high unemployment. And so they come together to make that kind of very dark, very saturated purple, which we see here in the Dundalk precinct. So that is kind of a way to show on one map where both variables are high, or both things have high preferences. On the right is the original census tract view of the social determinant. So it gives you a little bit more of a granular level view, a little bit lower level view of where some of these social determinants are actually more or less elevated within the precinct. So for example, in the Dundalk precinct on the right, you can see there are 2 or 3 census tracts that are very dark green that are kind of bringing the unemployment rate for the whole precinct up a little bit.
And also just to kind of go through the rest of the colors, so that dark green color would be sort of, correct me if I'm wrong, higher unemployment, but mid-level relative to other precincts, domestic violence data, all the way down to, you know, you have some more there is middle of the road, like the medium shaded blue is kind of higher domestic violence, but lower unemployment. So I think it gives it kind of shows the correlation, but how it's not a perfect one-to-one match for some of these. And again, there's plenty more of these slides that I think will spell that out.
So here we can see, like I said, the Dundalk region in particular has both high DV victims and high unemployment relative to the rest of the precinct in the county. Same overview, but for child poverty, so this is a good analog for family poverty, for underserved communities. If you want to go to the next slide. So again, the map on the left is pretty much going to stay consistent from now on, at least the purple one. It's the same countywide view of the DV rate in 2023. On the right, though, that's the one that's going to change now because we're investigating a different determinant. So in this case, it's children that live in families or households that are below the poverty line. And we can see that that darkest red color again is down in our Dundalk and Essex precinct, and is lower up through Packers on Pikesville. And then here again, comparing the two on the left, that very deep purple region is kind of expanded a little bit to be both the Dundalk and the Essex precinct. The White Marsh area, I apologize, I don't know the official names of the precincts, but the one that includes White Marsh and Perry Hall. Is kind of the bluish purple, which shows that it has slightly lower children below the poverty line, but still elevated DV rates. Through mental distress. So this one's interesting. The past two have been from the census, the 2023 ACS estimate. This one is from the CDC. They have a program called the Places program. Local data for better health, I think is like the slogan for it. But this is like you go to the doctor for something, your PCP, the hospital, whatever, and they give you the questionnaire beforehand to fill out. So this is going to be, the doctor will take that and report it up to the state and reports it up to the federal level. But there's going to be a question on there, have you experienced mental distress within the last 6 months or something similar? The wording is going to vary, but they've taken it and kind of normalized everything. So this is not based on diagnoses, it's not based on self-reporting or anything, or at least not people reaching out to the CDC, but it's based on people filling out those questionnaires when they go to the doctor. So the pattern is pretty consistent with how it's been for the last couple slides. You can see that Dundalk and Essex both have elevated rates of both mental distress and DV rates relative to the rest of the precinct. And there it is, just in that bivariate color. Again, that deep purple is down in the southeast. And then you've got the White Marsh precinct, and kind of that blue purple. Any questions so far? Take a look at English proficiency. This one is again from the census. So when you get asked how many people in the household speak English proficiently, this is the answer to that question. So we've got, I was surprised in this map, Juliana, you're probably less surprised about it. I thought that the English proficiency would be lower, closer down here, Highlandtown, Dundalk, but it is highest in the White Marsh precinct. And we'll see a view in the tracks on the next slide. It's a little bit more localized, but again, you can see that.
Oops, sorry.
You're good. Because of that, the darkest purple colors moved up to White Marsh, whereas the Essex and Dundalk show a lower correlation. They still have high DV rates, obviously, but that level of less proficient English speakers is lower in the Dundalk and Essex precincts relative to the rest of the county.
I think the census tract slide here is particularly interesting. So it shows that it's not just constant. The number of adults who have limited English is not concentrated in just one or two particular areas, but it is throughout the entirety of Baltimore County. Obviously, in certain areas, you're going to have higher numbers, a couple census tracts nearby one another, but it's not one cluster or even just two clusters, but you see it spread out throughout really everywhere somewhat close to the Beltway.
I think this is our last one. So bachelor's attainment, educational attainment. And this one's a little bit weird because instead of looking for incidences where both variables are high, in this case, we're interested in where DV rates are still elevated, but bachelor's attainment is low, where the education is not as high in the community. And so you can see that now Cockeysville is really bright red, but that means that it has high rates of people who have their bachelor's degree. As opposed to down in Dundalk and Essex, we've got the opposite of that, is lower educational attainment. And so on this slide, we're actually looking for that very saturated sky blue. You'll see it's at the top of the scale now. I rotated it. But that's those places where bachelor's attainment or higher is very low, but your BV rate is still elevated. And this one's interesting because it almost starts highlighting the west side of the county, near Catonsville, which we haven't really seen in any of our other ones as a correlation, but in this case, just based on how the educational attainment is distributed across the county, it's something that shows that they are related there. And on the right, you can see that that dark green again shows that there's very high educational attainment up through Cockeysville, kind of up through the northern sections of the county, and then the southeastern part at the lower educational attainment.
Yeah, I think this is almost the opposite of the last slide with the wide dispersion of adults with limited English versus, in this case, pretty centralized and clustered adults with a bachelor's degree or higher. And again, there are other areas where there may be a majority of adults who have degrees, but this really is pretty stark. Towson, Pikesville, the Cockeysville area, Lutherville, Timonium, and areas kind of east of Owings Mills and Reisterstown. It's pretty dramatic compared to, and then obviously there is that cluster around Catonsville, which I think also, Councilman Young can correct me if I'm wrong here, is around close to the UMBC area, right in it. Yeah, which makes sense for people who are going to be living in the area, maybe more likely to be professors or in some respects working with the school. Graduate students, yeah, that's true. So I think now the part of the goal of this presentation is that I think for a lot of the issues that surround domestic violence, but particularly issues that surround the contributing factors, it's very easy we all have heard anecdotal evidence and stories and conversations surrounding these issues. And I think it's good to be grounded in data as much as possible and grounded in what we can see factually. And I really want to thank Harrison and BC Stat for this, because I think the social determinants of health data is really important for a lot of reasons, but I also think it's really interesting to overlay it with this particular and correlate it with this particular issue, because it's very easy to, again, when we're looking at issues like poverty or childhood poverty, to understand, we all know it's a challenge. We all know that unfortunately a lot of these sort of negative outcomes correlate and are in the same areas, but this, I think, highlights it in a way that's data driven instead of just, again, anecdotally or narratively driven. So I would like to open it up if anyone has any reactions, questions, comments, thoughts, otherwise, or kind of next steps in this area that you'd be interested in us going, because again, this is sort of the top level, but we can probably dive deeper on this.
None of this was much of a surprise to me.
Yeah.
The areas that have the highest propensity for violence, overlays to social health are very similar to south, right? So I think part of the question, to expand upon that, is it violence in general?
Mm-hmm.
And is there anything that differentiates? Can data help us differentiate one type of violence versus another? Right? If we were to add in animal abuse, add child abuse, add in other types of violence, would we be able to tease out any difference or not?
Yeah.
I'm guessing probably not, but it might be interesting if there were differences. I think the Towson area stands out to me because that's not an area of child abuse, but seems to be right. So I don't. One of those things you don't know until you see it, but the data could help us sort of tease out any differences. And that's hypothesize, right? But
if I get it, I'll do it.
Right.
And I wanted to pull up the unemployment slide here, because I think Director Millspaw makes a great point that Towson is kind of a unique precinct because it does have sort of that mid-range where it's not on the it's not on the low end of domestic violence per 10,000, which again should address for density, right? Because Towson's a very dense precinct, but since it's by 10,000, that shouldn't skew the numbers wildly. But the fact that it has that while having amongst the lowest unemployment and amongst the highest college attainment is an interesting one, because it doesn't seem to correlate as clearly as, again, not to highlight Dundalk at the exclusion of others, but Dundalk has higher unemployment and lower rates of college attainment and higher percentages of childhood poverty, and has higher domestic violence. So it's sort of more of a straight line, I guess. But with Towson, it jumped out to me is that it's not amongst the lowest precincts in the county for domestic violence, but it is amongst, I guess, the highest for economic attainment.
I think, something that kind of, when I talk to people about incidents of intimate partner violence, one of the main things that we talk about is that it doesn't necessarily, it's not, a lot of assumptions are made that victims of intimate partner violence come from low income, low educated areas, but that's sort of a fallacy. And I remember back many years ago, I was reaching out to an all girls private school saying that they should have Lisa Sticknell come talk to the girls in high school about safe dating and what is and isn't appropriate, because of what happened to Lisa Sticknell. Many of you probably know her husband had murdered her 2 children after she had gone to the courts and gotten a protective order, and the courts granted the order but gave him unsupervised visitation. And, I mentioned to this guidance counselor that this was something I thought would be really important for the girls at the school to hear about her perspective, because she would go on a speaking engagement. And the guidance counselor said to me, our girls don't have that problem. And then 2 years or 3 years later, Yardley Love was murdered at UVA. So I think these numbers are great, because certainly from policing and social services aspects and the work that our nonprofits do, but it's also important that we realize, just like that Towson sort of figure shows, that there might be more affluence and more higher educated, but they still have a high level of DV.
Yeah.
So making sure, that we don't have this kind of idea that, this only, and I know we don't in this room, but I think sometimes those numbers were like, oh yeah, that makes sense because of boom, 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 boom. I don't know, it's just a thought.
No, I think that's an important point, that it's not that ultimately, the data is the data, but there are still these incidences happening, and there's still, and perhaps addressing those distinctions is important, that it may take a different approach or a different tact when you have communities that are obviously still experiencing domestic violence, but may not also be experiencing other challenges. How do you address the issue there versus in communities where it's domestic violence, but it's also violent crime in general, child abuse in general, those kinds of issues? It's kind of they're almost may require 2 different strategies. I saw a man with their hand up as well, so I want to turn quickly to. Sorry, I just got a WebEx issue. I apologize. Sorry.
Yeah.
Why is it not letting me? Mhm.
report or
That's interesting. Yeah, so I think that is reflective of, again, these calls for service are broader and not narrowed down to, again, like the specific, again, the severity of the incident, which is going to be a further different issue, right? Because that also factors in other things like access to firearms for one. Mhm.
uh, uh, so the on call room, uh, exactly. So I'm wondering if there's an overlay of where the actual
Mhm.
find out the program, right? But how what's happening that is uh, it's part of it. Importantly, those are, is it different for
Amy, can you move your microphone closer to you? I think that might help, because some of the folks online are having a hard time, and that might help.
so so many overlays, but one of the
Mhm.
and survive. Some is also is
Yeah, and I think that's a good point. And I'm just going to restate, because some folks are having a hard time picking up. And I don't know if this is the microphones down at that end who aren't working, or the room in general. But again, to Amy was highlighting that there's this data has a limitation, essentially, which is that if people are not reporting, if they're living with domestic violence and abuse and not going to the police, it's not going to get picked up in the left-hand column data, which is the data regarding 911 calls. And obviously, if you don't use 911 or you don't go to the police in general, it's not going to come out that way. So I do think, and part of my hope too is that we can work with the providers and also work with state's attorney's office to do a better job of collecting data that kind of shows that. Because obviously, if someone's going to a provider for help but isn't pursuing criminal charges, is not calling 911, it is a challenge to reflect that. And again, also then it's the question of, well, how do you differentiate between somebody who is receiving extensive services versus somebody who may be coming in to see what their options are, right? And not. So again, there's a lot. This is not the sort of definitive data set, but I think it's trying to find, again, not even the best, but some kind of a starting point for, all right, acknowledging that these rates are higher in these areas. Councilman Young, I saw you had your.
Oh, I just wanted to mention that a lot of this, for example, sexual assaults. When I retired from GBMC, we had many students come in reporting that wanted anonymous kits. And so you never get those numbers.
Right.
So there are, I think, many, like Amy said, that we don't have in this report.
Could social services somehow catch some of the people that go, to our organizations? We also connect with social services, and Karen Kaiser and Vicki Sneed are amazing at getting services. And they oftentimes never go to the police, but they get services from social services. So I'm wondering, and there's reasons why they don't go to the police. It's not, sometimes they're afraid, they don't want to involve the criminal justice system because they don't want the abuser to get arrested, or their immigration issues, and there's all kinds of complex reasons, but a lot of them we get services from you guys, and you do unbelievable work with them, without them ever going and filing commissioner charges or reaching out to the police. So I don't know if that's a way to bring in a wider net.
Yeah, I think that's what Amanda was referencing earlier, because a lot of those were referring to programs for the ones we're serving directly. Fortunately, we don't have it. So that
You can fix
our
that.
own.
No, you're the wrong person. Joy's over there.
But, yeah, I mean, I think there's more data from BC Tech. I think what Harrison was looking for when I brought that up is, I'm one of the agencies, we don't have a data, I'm a state agency, we don't have a data sharing agreement with the county to share like child abuse data with BC Tech.
Mhm.
Long-standing problem. With BC Tech, so it's just, I gotta get to that. But they have one, I think you still have one with Department of Labor for unemployment data.
Yeah. But it sounds like well,
This administration is far more. I was starting with SNAP, I thought SNAP data was.
Right.
And then I start working on child welfare. Much more active, but
I can't imagine that
It's
it's that
all-
expensive.
no,
It's not an expense, because right now the expenses are, the issue, but this would only just make sense.
I'm glad I have a lot of questions. Also, now talking. Or like, not to get in the way, I mean, how is this going well? This would be very helpful. Group, or even group that wants, again, not to get ahead. No, it's fine, I'm happy to send a letter, just be supportive of the agreement. Another, happy.
couldn't hurt. The issue now on the current administration isn't a willingness issue, it's more capacity. Implemented a whole system in 2020, COVID, and that system has lots of problems. So just a matter. Do they have good enough data that they're willing to share?
So part of my question was actually, this is focused on that. So what was fan growth for what we're not catching. And I just want to thank you all for putting this together. Because the maps that we received when you all for questions, I run and what it really meant, what we were seeing, like, I mean, my question is then now from we have data, just like anything. We have the data now, we asked for it. No one's surprised that living this world working. And we have individual providers as part of this group. Maybe this isn't the place to have the conversation, but what's the strategy? Knowing that these areas, determined. So which ones are that we're doing, or even selectively by at addressing the issue, and then rallying them to move people. And what I mean is that
make the question, where is that conversation? And if it's not happening, that's also an issue.
Mhm.
But I would love. After addressing bringing that have on a particular camera and see that we've actually made an impact
Sure.
on them. To be
And just, there's Shelby wanted clarification on the question. Again, I think, sorry for the microphones technology, but the question was really what the next step is to address this. Now that we have the data that goes, that next step beyond the police data to overlay it with the broader picture data, what can be done to address it? And I think that the answer is, in part, I think, yes, it is absolutely the space of this working group to discuss that and to discuss proposals. And I will say, as I've said before, if anybody wants to, make that conversation a focus for a meeting, please, again, we can do that, because I'm not an expert in this field. My goal is just to facilitate this conversation and to allow it to happen so we can have those discussions, and that follow-up on talking specific nuts and bolts, what can be done to move the needle on these issues. Yeah.
Yeah, no, right. Working. Can be done. Release. Advocate. One. That in addressing these are key. Which ones? Look. In here.
Right.
And like, got right in the heart of where, and yet, why that if we determine that that's the needle that needs to move.
And I think something, Councilman Young, that you alluded to, but I wanted to flesh out is, and that Joy piggybacked off of, is, to me, there's an opportunity to, I'll take a step back. I think in a lot of the conversations surrounding whether it be housing, poverty, unemployment, you name it, the conversation very rarely, I think, includes this side of the picture, right? And obviously we can't say definitively that one causes the other. And there are obviously many, many instances where it's unrelated economic well-being. It's people who are affluent, live comfortably, have nice homes, and there still are catastrophic events of domestic violence that occur. But I think that there's an opportunity to bring the impact on survivors that policies that are intended to address poverty, unemployment, again, housing insecurity, where typically that doesn't come into the conversation. And I want to be sort of delicate in the way that I word it, but I think when there are conversations, and I'll just pick the housing issue because we discussed it last year about housing affordability and accessibility in Baltimore County, there's a lot of very valuable perspectives that come into play. You don't always hear the perspective of, okay, well, how is the current situation negatively impacting people who are trying to get out of scenarios where they are facing violence and they don't have a realistic, affordable alternative that maintains some degree of quality of life. So I think bringing these perspectives to the table is a part of that as well, to say, hey, we see in Southeast Baltimore County very high levels of domestic violence at calls for service. We also see very high levels of unemployment. We can't say definitively that reducing unemployment will reduce domestic violence, but I think it's part of that conversation as well. So I think it brings that perspective into the table where, again, I think oftentimes domestic violence is often discussed in the political arena as its sort of own issue.
Well, when you do lethality factors too, the unemployment is generally is a tick up for whether someone's in a really, really dangerous situation, such as firearm ownership. Unemployment is a big ticker. Help Me Advocates, what's another one? Children with someone else, and that can tick it up.
Prior
strangulation or prior assault and prior strangulation. So I think these are good things to look at because we know that those can pick up the lethality and put people in dangerous situations.
Yeah. Sure.
Things that I think also they're poverty, wonderful.
Right. And I think that's a really important point. That's kind of why I was saying, like, there's that element of, if there's already a debate about an issue that would impact, again, like you said, like the poverty issue, that then it doesn't hurt to include the angle that, these are correlated. But I also agree that we simultaneously can't lose sight of the fact that you don't want the discussion to be so reductive that it misses people who, like you said, where ultimately poverty isn't what causes these issues, but it can be correlated to it. And so I think that's an important kind of like caveat to any of these things. Like it's not just as simple as socioeconomic status. And I also think that can have a drawback too, if it becomes attached just to socioeconomic status, and that can easily lead to a somewhat, I would say, maybe even like patronizing view of the issue, instead of addressing the fact that, like, ultimately this is a decision that a person's making to be controlling and abusive to their partner.
And it can shift the blame to the victim too.
Yep.
Oh, well, of course, you're in this horrible situation and you're not doing anything to get out of it. And it's because you are unemployed, or it's because this, or it's because that, kind of, and it's the abuser's unemployed too. I'm sure when it comes to unemployment, are they just tracking the alleged abuser, or is it also the victim?
I think it's unemployment so it's the unemployment rate in that precinct.
Okay.
So
overall.
As a whole.
Okay.
As a whole. So it's none of these are the, English proficiency of the abuser or victim, whether or not there's a child, just the population of that area.
So maybe one of the things we could be expanding in, now we look at this, the overlay social determinants of health, what other data could we overlay, whether we have questions, but I think, gun ownership, right, is it data on gun ownership? Alcohol sales, right, like, do we get data on sales of alcohol?
And gun ownership is run by the state, so you have access to that.
I think the liquor store point too, because even that wouldn't necessarily correlate directly to sales. If you have communities that have higher numbers of liquor stores, they're not going to open and get licenses and be able to maintain business without having significant consumption.
And we can probably specifically. And there is a direct correlation with the density of alcohol establishments in the communities and domestic violence.
And drugs.
Yeah.
Fair.
Yeah, I mean, I think that makes sense. I don't know if it's a lethality indicator is, whether or not substance
Yeah.
abuse would be
Yeah.
which would again make sense because that's gonna heighten emotions.
Yeah, when you look at our overall crime, look at even our overdose, when you lay those maps over top of all of it, they all fall right in the same.
Mhm.
And it's been like that historically for decades, right?
It's always.
Yeah.
Even auto thefts and carjacking. And you lay those things, and they're not even domestic violence related.
Right.
All this thing, everything, you overlay everything, it always falls in the same area, same community.
Right.
The way that Palmer County handles its liquor. Well, wait, sorry. They were. Okay, sorry.
Yeah.
I was curious because it sounds like we're more restricted compared to in terms of concentration. Am I wrong? Like compared to Baltimore City, because they limit the number of liquor licenses per district.
You gotta look at, but
Yes.
but what you have to look at is you have to look historically go back, for decades. If you went back 40, 50 years, and you look at where, where they are, but when it continues to be the rest of the liquor establishments in Baltimore County, but then where they are for a long time.
Mhm.
But then even when you look at many of them are added in communities where it's always already a density problem.
Then that'd be great. But once they try to move in.
Are there other data elements, like I'm curious from the providers, like would student absenteeism, student rate, right? Is there a correlation between students missing school and
Yeah,
primary caregiver?
yeah, graduation rates, I mean. You can pretty much name the school.
Yeah. That's also applied for what we call. But one of the things that really struck me back so I know yeah, for turnaround, we can turn think that's what we talked about. From. Very much. You know, like, work, or.
Mhm.
And do you even know what your. uh, How do we know where to spend more?
Sure.
We can certainly. They would come. With work. But I do. think,
Mhm.
And state funding is one thing. I think. I think looking at how the county.
Sure.
Crisis center. So I think money go.
Sure.
We don't have service provider. Unified. You have to report this. This. Because. Yeah.
Mhm.
I think money is.
And and it's a very extensive, very thoughtful process. But we have one office that handles all those things, and they divide them up into housing. They divide them up into social services. And so it's, I think, it would be what grants we have, how much is, it's funded entities. And so I don't think that that's very difficult because I know we have an office for.
Yes, I mean, on one level. What else? But if you're going to have victims survivors like report.
Mhm.
Zero. Less. I don't like it. From very. Know when you're looking. Or.
Well, we capture all that information though with every client, where they live, how they got to us, how they were referred, whether or not they did or didn't pursue police action. All of it is, kept in like part of its legal server. And then we have quarterly reports that we have to justify the money that we spend every quarter for MLSC, for the AOC, VOCA. So, I mean, that's all has to be, because we're all pretty much 90% grant funded through state and federal funds.
So might not.
Right, we have to keep it all. I mean, I know you guys have to do it too. We have to have all that information, and we have to constantly, every quarter, be letting them know whether or not we did or didn't meet our performance measures. And whether there were, challenges in meeting them, what were those challenges? But we also demographically, like where our services are. Most of our clients, Baltimore City, Baltimore County, where in the county are they coming from by zip code? So, I mean, we have to, just for compliance purposes, have that. So all of the nonprofits have to do that.
I think that's a really important next part of this conversation.
Yeah, I know my COO would hate it. I said, guess what?
Yeah.
Now we're gonna have another person to report to. But I mean, all of these service providers have to do that
Right.
in order to justify their grants.
Right. No, I think that's the next, And it's the tricky question is, where is the money going? Again, where can it come from? So, especially in the context of the current budget situation, right? Is that there are limits and there's a tremendous amount of uncertainty. As the county executive said at every budget town hall, there's a tremendous amount of uncertainty as far as what's coming down the pipe and how that's going to impact. Again, I know doesn't seem like that has been the target. There's a concern about obviously grant funding of any type getting spontaneously frozen. So
With our control. I understand. I, I'm how we
Budget to work with. Budget to- Correct me. Yeah, maybe. Yeah, maybe.
So. Yeah. You know, I just.
It's supposed to go past though, I think they have to, you know, even if it's federal and it goes through GoPath, they have to. Mhm.
I can talk to Rebecca Allen about it. She dropped off because room 118 is great, but I will follow up and see kind of what information, because she shared some, but I can see kind of what they have at their end, because she deals with the grants from the state level there, at least to an extent.
But with all this. Oh. While we're seeing them over
Sure. That's great. That's great. Yeah. Well, I think we have a lot to go forward with on this. Does anyone else have any comments, questions, thoughts, ideas? And again, please reach out to me if there's anything that comes to mind afterwards. I know I'm going to be reaching out to some of the folks who were on the call just to make sure that they're, you know, fully integrated into it, because we want to make sure that everyone's, you know, equally able to participate. But yes.
the women's health month. Well, and network. Is there anything going on? With
That's a great question. I don't have in front of me what we're doing countywide for May, but
no, I just put it out there as a thought.
it's a good thought.
And
Yes.
Our HHS comes to.
yeah. I just think one.
Mhm.
Yeah.
Sure. Yeah. And so, yeah, I think that Joy's right that we can touch base with Erica and make sure that office communications, see what they're doing and circulate amongst the working group as well. But thank you for flagging that. Yeah, exactly. Yeah.
Well, I'll let you know, the Women's Law Center is having an annual event on May the 6th, and we are honoring all of the advocates that have been supporting our clients. So the Department of Social Services, we're honoring Vicki Sneed because she's amazing and goes above and beyond the call of duty when it comes to helping clients that come to us. We're also lifting up Shelby Frank from Crisis Center and getting her award, as well as a few of the county attorneys that represent our clients in divorce and custody cases through the Judicare program. So I'll give you an invitation. Everybody's invited. You can look it up on our website. I do have some invitations, invites here. I didn't bring it to the Bronx a lot, but it'll be May the 6th at the Rye Street Tavern, which is a Baltimore City venue. But we changed our Baltimore County venue because it was a little Trumpy. Sorry to bring politics into it.
That's fair.
Just didn't fit sort of the agenda for the people that we serve. So yeah, I'll let you have that.
If you don't mind sharing that with me, I can also circulate it to the working group mailing list since we've got everybody. Thank you. Yeah, and in general, that's also kind of a outstanding point, is that there's anything that people want, again, we're happy to make sure there's awareness about these events and access to them for everybody in the working group. So if your organization or event has something you want to flag.
October, okay. All right, House of Ruth is tonight. That's at the Valley Mansion Inn, I think. Yeah, so that's tonight.
Mhm.
So,
Yeah.
what's it on? What's the webinar? It's on being trafficked. So and just trying.
On that note, is there, I know Senator Hedelman's not here, but we have the chief of staff of our wonderful delegate partner here. Is there any legislation that anyone's aware of that was passed that they want to flag? I know Sine Die just ended. This is me thinking out loud, but if there's anything that may be impactful to the purpose of this working group that went through this year.
So the human trafficking education through the Maryland Department of Transportation, did that pass?
Yes.
Yay, there you go, because that didn't pass last year, but it was not very expensive and it made a lot of sense, so that was a great thing.
Okay.
Mhm. Making it easy. Mhm. Tomorrow, rain or shine.
And it's supposed to rain.
I know, it's gonna be
It's
rainy.
Friday.
And-
Okay. Mhm. That's excellent. Yeah, and again, please send these over because I can circulate them. I know a lot of people here are on each other's mailing lists, but yeah. Well, I sure hope the recording is decent so that we can get it into the meeting notes as well and get those circulated out quickly. I can look into it. The only hesitancy there is I don't want to overly clutter the resource page. So if a survivor is looking for, like, they need to get help, like having it be, but yeah, I mean, we can look at a way to highlight events without, like, there's a way we can do it. We can make it work. Yeah, something like that. Yeah. I think that's a good idea. Yeah, to get awareness because there may be people who are looking at it who are not necessarily survivors or in that situation, but are looking at it to see what things the counties, what opportunities there are to get involved in the county. So that's great.
Does anybody have a point of contact in the Baltimore County Public Schools where they are addressing the issues of prevention when it comes to intimate partner violence? Can we talk, because I've been working with Baltimore City Schools and talking about the issue in a preventative way, that we can talk to teenagers about the issue of safe dating and how to recognize a situation when it's dangerous. Okay,
And you can also go through Maryland Center for School Safety as well.
because the Hate Crimes Commission that I'm working on now, I'm
Mhm.
working with MSDE and more on like hate crimes aspects,
Mhm.
which is a little bit different from this issue. And so it was just kind of the jurisdiction. Montgomery County has an excellent program that they have the kids develop on safe dating, because it's one thing to have a nonprofit come in and have some 62-year-old lady come in there and talk about safe dating. People will be not that receptive, but having it developed through the actual schools and having them participate on what is consent, what is safe, what is inappropriate, what's control and power and control, what's that mean? And have the kids kind of develop it with the guidance of a nonprofit organization like ours or Turnaround. Mhm.
If you. That's a lot of hell now.
Yeah.
Deal with this. Boards and commissions.
So, yeah, I think the public schools need it, just as much as the private schools, and I'm trying harder. Yeah, so.
And I think it's important to get into the middle schools. which
I
is
think
harder
harder
to
too,
do.
right, the middle schools.
That's where, and for trafficking too.
Mhm. Yeah, there are some one love hubs, but,
That's a great organization.
yeah, but then they had some internal issues. Yeah.
Councilman.
I mean, I'm happy to help with that.
Have we ever?
We did. We had a president. We talked about, I was on BCPS, someone from the Title IX office, someone from maybe it's Title IX from Towson University, but also we had someone from BCPS talk about it. It was a very general conversation.
Dude, you're going to do like a point of contact. Thinking for the whole system.
Mhm.
Engaging with different method violence or
I can look back and find the title of, yeah. Hmm.
inviting them to participate.
I can reach out again to,
No, I mean,
Make that
it's
connection.
but
I don't know if the new person is new since the last time that,
there's
It's
a-
extended. yeah, absolutely. Yes, they're part of the process. Yes.
I think it's important because, that's the one thing that Lisa Sticknell said to when she would go to organizations and speak, is that she was 17. Her abuser, and she didn't realize that it was not cool for him to tell her who she could or couldn't see, what clothes she could or couldn't wear, what job she could or couldn't have, and then she married him, and
Yeah.
it ended up being horrible and a nightmare. So catching them kids when they're young, I think is so important.
All right. Any parting thoughts? Okay. Well, thank you everyone for coming. I think this is a great conversation. I think we have a lot to go forward with, and be following up with those again. If anyone has anything they want to send to me to circulate, or any follow-up points of conversation or ideas for next steps, you'll have my email address.
Thanks, Henry.
All right. Thank you all.